The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, seems to be the go-to guy when you want to get dental implants in the Salt Lake area. Here with us, we have Dr. Austin. Dr. Austin, welcome to the program.
Thank you very much.
Now, before we get into today's topic, tell us a little bit about your practice.
Well, my practice is located in the Gateway Mall, which is right in downtown Salt Lake City.
It's a big, beautiful mall.
Big, beautiful. It was built for the 2002 Olympics.
Okay.
And it was a hub for a lot of activity back then, and still is. And so we decided to move our dental implant practice into that area, and it has become a focus point for Utah.
Okay, what type of patients do you see? We've invited you to talk about dental implants, but you do a lot of things, I guess.
We do. We do comprehensive dental work. I mean, people that have lots of different types of problems come to us. High socioeconomic status, people that are just have one or two teeth that are missing and need problems, need restoration, small concerns to large concerns. We really do a comprehensive treatment plan on every single patient.
Now you, which is interesting, it's in 7th grade you knew you wanted to be a dentist.
Yeah.
Why dentistry?
You know, it's a weird thing.
Dentists in your family, by the way?
No dentists in my family. Yeah, my dad was an accountant. I was cleaning out their house and I found some old brochures from 7th grade, and here's all these dental brochures. So it's something that I've wanted to be my whole life.
Really? So
yeah.
All through high school you said, I'm going to be a dentist.
I had nothing else in my mind. It's just like, what do I need to do to become a dentist? It was just part
You love it. You like it.
I really do. It's fabulous.
And your son now is going to be a dentist.
My son is a dentist. He just graduated last year from Baltimore, University of Maryland, and now he's going to be an oral surgeon. So my daughter's a hygienist that works in my office. And
wow.
So we've got
good for you.
Dental in our blood here a little bit.
Okay, Georgetown University. Tell me, let's talk a little bit about your background and training.
Okay. I graduated with a degree in chemistry and then decided to go to dental school at Georgetown in Washington, D.C. It was a fabulous experience, great training. And then when I got out of school, I realized, you know what, I'm not just going to be the regular dentist that's just going to do what they learned in dental school. I'm going to continue on. I'm going to learn new things. And so from the very get-go, I started my march towards continuing education. And
you went to LVI. LVI, I guess, is what Juilliard is to music. Dentists from all over the world go there to learn what?
Well, they learn how to do cosmetic dentistry, basically, and to position people's jaws in the right position in a comfortable bite relationship so that you can function and have great looking teeth. And so I graduated from there and then continued on doing residency programs in implants and also continuing education in new techniques in regards to implants.
Okay, now when we want to do this topic, hot topic, dental implants, we get a lot of emails on this.
Yeah.
We want somebody with a lot of experience, a lot of training. Nobel, tell me about your training with implants. You've been doing it quite some time, and I guess you do the surgery, then you also restore the implant or put the tooth on it.
Right.
Expand on that.
It's a comprehensive treatment. The thing is, when you place implants, you have to place them in such a position so that they can aesthetically be restored. So the same person that places them and positions them can also restore them aesthetically, and that's a key factor. You don't have to be farmed out as a patient to all of these different...
So it's all under one roof?
All under one roof, including ceramic arts laboratory. So everything is done as a team effort under one roof.
Now, you don't look like a dentist. Do people ever say that to you?
Yeah, I actually get that a lot. I don't look like a dentist.
You have a nice smile, though.
Thanks.
By the way. And do people tell you that, though, on a daily basis? I don't like the dentist.
Yeah, I hear that every day.
Oh, really?
Yeah, people come in.
Sincerely, they say, I don't like the dentist?
The thing that they say the most is this. I'd rather be anywhere than here. I'd rather have a baby than be here at the dentist.
Does that get old after a while, by the way?
We've heard this. Yeah, we've heard this. So what we do now is we make them so relaxed they don't say those things anymore.
You have a different kind of an office. I mean, I've just seen pictures, but a lot of style.
Yeah, you know what? It's an atmosphere so that people have had such horrible experiences in their life with dentistry and with dentists. I kind of don't blame them.
So get it done right the first time.
Yeah, our whole philosophy is this. Randy, it's this, is let's get it done once, right, that lasts the longest with the best materials, with the best technique, and let's do all that while you're pretty much asleep. So you forget the whole experience. So you don't have to...
I'm surprised to hear, you tell me that 90% of your patients, like that get dental implants, are asleep?
Yeah, even
right?
more. We sedate them. There's 2 ways to sedate people. We can give them medications so that they're quasi-awake. They don't remember the appointment, but they're responsive. And then we have an anesthesiologist that comes in if we really want to sedate somebody down that is extremely scared.
Do people request that, by the way?
Yeah.
To be out completely?
Out completely. Sometimes. But
they wake up, they have great
usually
teeth?
The sedation just works out perfectly because they're so relaxed. They can go home that night,
and not every
sleep it
dentist
off.
does sedation,
no.
By the way? So what, special license, special
special
training,
special licensure.
Okay.
But it's the type of thing that is so comfortable for people that when I tell them, you're really not going to remember this experience, they kind of look at me like, yeah, you know what, I've heard that before. And but it's really true. The next day they come into the office and I say, remember me? I said, oh, I don't remember much about you from the day before.
Really?
Yeah,
really?
They don't remember the experience. And yet they're awake. It's an extremely safe procedure. 98% of the people that we work on this way. People want to get this thing done quickly.
Okay.
They don't want to come in time and time again, have 3 visits for a root canal and then 2 more visits for this or that. They just want to get it done. And so I'm different in this way, in that I can offer a comprehensive treatment in 2 or 3 visits and get everything done. That's what I do. That's kind of my niche. That's kind of what I like to do.
So with dental implants, what are the different type of patients or categories of patients that you see?
Well, there's people that have, surprisingly, Randy, people as they age, they usually have some missing teeth. It's amazing. You get a big filling when you're a teenager, and it's a bigger filling when you're in your 20s, then you get a crown, and then you get a root canal, and then the tooth cracks and it has to come out. Okay. So, what happens is you have people that have 1 or 2 missing teeth. And, the mode used to be, we'll put bridges in. We'll grind down the teeth around the hole and put a bridge in, and that functions for 7 or 8 or 10 years. Then you do another one, and then you do another one. But now, with these types of dental implants, it's not necessary.
So you just give them their teeth back?
It's like getting your tooth back.
Is this true, by the way, that things have changed so much where you could actually go in one visit, get a dental implant, they go home with a tooth and their dental implant in one day? Is that a bit of an exaggeration for the right candidate?
Let me tell you, for the right person in the right situation, you can place an implant in and have a restoration placed that day.
That's the tooth you're talking about, the restoration.
Tooth, yeah. Okay. And that doesn't happen in every single situation, but the type of implants that we're using today and in which we're going to talk about have this ability to engage the bone so securely that you can almost have a tooth that same day in almost every circumstance. We temporize and place teeth in with people in an hour. They come in with a missing tooth, they walk out with
a tooth in an hour, teeth in an hour. That's real. I mean, you can do that.
It's really real. It's really real. There's different techniques we have of temporizing now so that we don't have to have these, what they call flippers, these little retainers with a tooth on it that you can't talk with, that you can't eat with, that you have to take out and clean after every meal.
So the people missing 1 tooth get a dental implant.
I did one yesterday.
Okay.
Person came in, cracked tooth, we removed the tooth, placed the dental implant, extended the post, made a tooth. It looked like he had nothing done in one day, in one visit.
And we've talked a little bit off camera quite a bit about this, but you think it could prevent future tooth loss by doing this?
I know it does.
Because nobody wants to lose their teeth.
Here's what happens when you lose a tooth. The other teeth start to fade into the space. Your teeth are kind of floating in there, actually.
All right.
I mean, if you think about it, it's kind of like artist's clay. You place teeth in and they kind of move around. Yeah. Well, if you're missing a tooth, the space fills in, the tooth above comes down into the space.
So like a snowball effect?
Yeah, all of a sudden you're missing 1 tooth. Now you've got a bite problem. Now you're starting to missing 2 teeth. Now you've got gum problems. Now you're on the way to losing even more teeth. And so it goes from 1 tooth to 2 to 3 teeth. Unless you place something in the bone that keeps the bone intact, that bone just melts away. Ask people that wear dentures years and years and years. What happens is those dentures get loose. And it happens with teeth that are missing. It's like having your arm in a sling. If you break your arm, that muscle and that bone will just start to deteriorate as you wear that splint. It's the same thing in the bone. It just it melts away.
So the one tooth. Okay. So the other categories are what of dental implant patients you see?
Here's what happens. One of the most traumatic experiences for me personally has been in my professional life when I've had to sit down with a patient who has some teeth left. They're missing some teeth, but they can't save their teeth. And I have to tell them that.
So their teeth have to go?
Yeah. It's bottom line. How would you like it if somebody sat down with you and said, you know what, your teeth have to go. Your teeth are so bad. You have such problems in there that your teeth have to be removed. And the only thing that we can do to replace them is to put removable dentures in and out. And you're going to have to wear that the rest of your life. I'm telling you what, it has an effect.
But you see a lot of people put it off. I mean, they leave the dentist, the general dentist, and they kind of put it off and put it off and put it off.
Well, they're afraid. This is what happens, is they're so afraid. They've had so many traumatic experiences. The shots don't numb. I have to go back. Something happened. You have to, it didn't work. And now I'm having to have that tooth pulled that I had worked on several times. It's just like they've had it with that. So the alternative used to be, this is the only thing we can do, is pull your teeth and give you dentures, and that's it.
Okay.
And so now you go from one problem to a long-lasting big problem.
Of dentures.
Of dentures, because dentures don't work. Ask people that wear them.
But knowing I'm going to interview you about dental implants, talk to my mother. She's 73 years old. She's been in dentures since she was 30 years old.
Yeah.
So she's 73, however long that is.
Okay.
And says, I'm too old. I don't have enough bone. Her medical doctor said they would fall out. I said, I don't know if that's the case. What's your response? And that must be a typical thing where patients self-diagnose or rule themselves out.
It's exactly, they X themselves out from, I'm hopeless. It's a hopeless situation for me. That's just simply not true anymore, because what can happen now is you can place implants in, you can place even 4 implants, and
so lower denture,
remove the lower denture, place 4 implants in, and place a fixed bridge in immediately, in some cases the very same day.
All right.
It's a remarkable thing. People come in with dentures, you can place the implants in, and with this technology, with this company that has developed this technique that's well proven, FDA regulated, 40 years of research, you place these 4 implants in and can walk out the door with bridge work.
Like fixed, but a fixed set of teeth.
Fixed set of teeth.
So they have the whole teeth. It's like a denture, but locked in with dentures?
That's right. No, they're locked in over the implants.
Okay.
So that the implants, the 4 triangulation implants, support the fixed bridge. It's a remarkable thing.
4 implants?
Yeah.
Do you think people count their teeth and think, wow, that's going to be very expensive to get all these dental implants?
It is so affordable compared to having dentures made and remade year after year. Every 2 or 3 years you have to have a new set of dentures.
But if it's as good as you say it is, why? And would you say that there's thousands, 20, 30,000 people in Utah, all of Utah, that have dentures?
Yeah, I would suppose so.
If it's as good as you say it is, why aren't they all getting dental implants?
You know what? They don't know about it.
Really?
Yeah, that's why they're not choosing to have it done, because they don't know what's available.
Or they think they're too old?
They think they're too old. They think that they're disqualified, or that there's not enough bone.
What about osteoporosis? I mean, somebody has a little bit of osteoporosis, they're in their 70s. You still, what, bone graft from the hip?
Well, listen, it used to be that the only resolution to this kind of a problem, to get rid of your dentures, is to do an extensive surgical procedure in the hospital, bone graft from the hip, other type of extensive grafting materials. These new type of implants have made it so that a lot of those candidates no longer need the grafting.
Okay.
Because the implant itself is self-bone condensing when you put it in.
What does that mean? It holds on?
It means it just engages the bone so tightly that you can load it with the teeth without having to place the bone graft material in. It's a remarkable technology.
Let me get this straight.
From the company that has done implants the longest.
So 10 years ago, is this true that the thought was that it took like 8-9 months for the bone to grab onto these implants?
Right.
So that's just not the case anymore?
That's
what shortened up the procedure?
It's exactly what's happened, is the procedure has been condensed down to a short time period, sometimes immediately loading these implants, like I mentioned, with teeth.
So walking in with dentures, they go to you, and they could potentially walk out with a fixed set of teeth.
Potentially.
No more dentures. That's your message. No more dentures.
Yeah, no more dentures.
You're going to get a billboard, you say.
Yeah. We're
Oh,
putting
yeah.
a billboard up on I-15.
To let the,
in
no
Salt
more
Lake City.
dentures.
No more dentures. That's the message, is that you don't have to wear dentures anymore. Think about that. People
That's
that have
not an
gone through
overstatement, though.
No,
Really?
no, it's done all the time now. It's just
Okay.
people don't know. People that wear dentures don't have a dentist because they don't have teeth.
That's a good point.
And so if
Very
they don't have
interesting.
teeth, they don't have a dentist.
So nobody's
Where are
telling
they
them.
getting the information from about this?
Wow.
They just don't have any source of true information about this kind of technology.
We talked 4 implants. I had a periodontist, true story. You know, our
Yeah.
show airs nationwide, all types of, from heart surgeons, this and that. And I asked a periodontist here in California, and I said, 4 implants to give them something fixed. They said, no, it's not enough implants. You need about 8.
Yeah. Well, that's what you used to need until
This is recent, a couple of months ago.
Well,
That's a real story. What is your response to that?
My response to that is the technology with these types of implants and the triangulation. It's like a bridge. If you look at these modern bridges, there's 3 focus points of triangulation. You put 2 implants here. And
You mean angled? When you're saying triangulation,
yes,
they're angled?
you angle the implants, 2 here, 2 on the side, and then you've put the fixed bridge work in immediately. They're successful. They're
that right?
95% success rate with this type of procedure. It's
Pain, though. Well, it's got to be a painful procedure.
It's less for most people than having a tooth pulled. You take 800 milligrams of ibuprofen. You take
That's it.
4 Advil.
Oh, really?
Most people get by with that.
You brought some photos. We're going to take a quick
Yeah.
break. We come back. We'll go through the photos and talk about the upper as well. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. It's what you need to know if you're considering dental implants, and especially if you have a loose-fitting denture. We'll be right back. You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. No more dentures. Today's topic, what you need to know about dental implants. With us, we have an expert on the topic, Dr. Austin. Okay, so you brought some photos.
I did.
What are we looking at here?
I brought some photos of, this is such a neat lady. I mean, she
Okay.
came to me from Georgia and she said, you know what, I am so ashamed of my smile and now my front teeth are breaking down.
Those are what? That's a denture?
Yeah,
of some sort?
these are bridges and crowns that have broken off. You know, her teeth have just crumbled underneath. This is a common thing.
Is this one of the happiest group of patients? That means people, you give them their teeth back?
Let me tell you, this lady isn't a perfect
Okay, so with
example.
her, okay.
So
with
you know
her
what
for the sake of
happens is
time.
she comes in and says, I don't want to have anything removable that I have to take in and out after meals and clean it and have my husband see me without teeth. She said to me, I want the widest teeth that you can make. I want the widest teeth. I want everybody to know who I am when I'm in Georgia. And so we did. We made her the teeth that fit her smile. It's exactly what she
Huge
wanted.
difference.
It's
before and
enormous
after.
difference.
So
Yeah.
what does she say? When it's all done, I mean, she looks at herself in the mirror. Is it emotional?
It's a huge emotional change for her. And she said, this is exactly what we want. This is what we kind of focus on in our practice, is making sure the patient gets what they want.
What are the age ranges of the patients you see? I mean, from the low end to the high end.
Well, we saw a young woman who, 18 years old, needed some cosmetic treatments, needed some work, missing teeth, missing lateral incisors that were congenitally missing. And then we see people in their 80s that, you know, are just tired
Why
of
would an
wearing.
80-year-old, though, want to go through that process?
Through what process?
Through the, well, it seems like the pain and the...
No, are you
and-
kidding?
and-
Randy, this is the deal, is that you can have these procedures done under a sedative technique, under sedation, where you don't remember the entire visit. You're conscious, you're awake, but you're in a sleep mode.
Okay, so you have, and we are running out of time. Okay,
Yeah.
so what are we looking at there? This is pretty dramatic right there.
Well, this is an individual that came in and I asked him to smile, and that's what he did.
Now, he looks angry.
You know what?
Like an angry guy.
He looks that way, but the fact of the matter is, he's a very happy guy. So we went in and did a complete restoration on him, and now he can smile. He looks like
boy.
20 years younger. It changed his life.
This is dramatic.
Here's the deal, is that you compare what people look like and how they feel about themselves before you have this kind of dental work done, and compare that with after they have it done, and it's like...
He looks younger, by the way.
It's
for
like
sure.
there's a new person. And the family members come to me and say, I can't tell you how much this has improved his life.
Did they
and-
ever tell you, I should have done this years ago?
Oh, all the time.
Really?
Yeah. People never come back and say, oh, I waited too long. They always come back and say, you know what? I should have done this years ago because I feel so good about myself. Young woman came to me. She had deep staining, missing a couple of teeth. We restored her. She wrote me this big, long email, emotional email, telling me how much it had meant to her that I had taken the time and effort to go and get educated so that I could take care of this for her.
Wow.
And it was an emotional thing. I just saw her last week. Big hug.
No, we're almost out of time, but upper. So you do upper and lower, or is it mostly lower fixed teeth?
We do the
dentures?
upper as well, because the problem with the upper denture is that you lose the ability to taste your food. Think about this.
Why is that?
Because the palate is completely covered. All those taste buds are covered over, and you know, it's pleasurable to eat food. But if you can't taste your food while you're eating,
Do they say they taste?
Yeah, they can't do
But
it.
do they say they taste their food better?
Yes,
once they get-
absolutely. As soon as you get fixed bridges back and permanent teeth in your mouth, it's like getting your teeth back. People feel better about things, they can eat better, and they start to smile more.
Okay, what are the fears, by the way? They go in to your office. What do they always want to know? What are the fears that they have when they're, let's say, the denture? What do they want to know on that consult?
Well, what they want to know is, does it work? I mean, does it really work? Can you place implants in and make me a fixed bridge? The answer to that is yes.
Okay.
Almost everyone can have some type of fixed teeth in their mouth. You really don't have to have dentures anymore.
Okay.
No more dentures is really true.
Okay,
out
okay,
there.
okay.
And then, of course, the affordability is a factor. But nowadays, there's lots of different ways to take care of it.
Well, I guess they count their teeth. They think they need, 12 implants, and they just need 4.
That's exactly right.
Okay.
So the 4 implants, placing the fixed bridge on there, makes it affordable.
One of the things I like that you said over there, that if there was a tryout period, like a test drive on a fixed set of teeth for the denture, they couldn't go back.
Oh, well.
You believe that?
You know, here's what happens is, once the people get fixed teeth again, they have no idea, they can't believe that they've gone this long without them.
Okay.
And so they have gone years and years and years with this lower quality of life, and now they're back again. It's like giving them an injection of youth, because they can chew their food again, they can smile again, they're confident. It's an amazing thing. They would never go back to dentures, never.
So
if you don't have to wear dentures, guess what? You never would wear dentures. People that say, oh, I like my dentures, they're great. No, they don't. No, they
Why,
don't.
they tell you that on the
Yeah,
consult?
they say that, I like my dentures, I'm fine with my dentures. Would you really like them if you could get your teeth back painlessly?
Well, okay,
That's the
painlessly, that's the
question.
key here.
Would you really, really prefer dentures over your own teeth? That's the question. No one would prefer dentures over their own teeth.
Wow.
They discolor, the gums turn pinkish gray. Have you seen this?
No, I haven't, by the way.
And people have, in it, they get loose. They know they have to go in and get relined again. You know, I mean, it's like getting your tires changed again. Every couple of years, you have to go in and get a reline to try to get them tighter.
So 4 dental implants, so we are out of time, but 4 dental implants.
Yeah.
Get a fixed set of teeth in as little as maybe a couple of appointments.
Yeah, most appointments you can put the fixed set of teeth in the same day that you place the implants, in one visit.
And they go home and they have teeth.
painlessly. You go home with teeth.
Really?
It's an amazing
Okay,
technique.
so to get this started, somebody watching this, they say, okay, I want to know more. Where do they go? They go to your website, they go get a consult with you.
Yeah, Gateway Dental Arts. You go to my website. Lots of information about there.
But can you make them look real? Because I always feel like I could spot dentures, 20 yards away.
Here's the thing on
Have
this.
they gotten better? I mean, do you make them look good?
Here's the thing on this. People that have this done correctly, you cannot tell that they've had any dental work done. Isn't that what everybody wants? You
Okay.
don't want people to come in and say, wow, where'd you get your teeth done? You don't want them to think that.
All right, all right.
The way that we do this is we have an award-winning ceramist in my office, Eric Newell, who has done tremendous work on celebrities, Miss America, Mrs. America. He is a very talented artist, and he can make teeth look natural.
So right there with you.
Right
He
in the
works
same
there.
office.
Okay. Is that rare?
We form a team.
Is that rare that you have this?
Yes.
They're normally sent out, is that right?
You usually send out impressions and they come back and they are what they are and you put them in. And people, if you want to tweak things, if you want to make them look natural to fit your face, the person that's actually making the teeth and myself and the patient, we form a team together. It's really fun.
Okay,
What
you like
happens-
this stuff.
Yeah, what happens is you get together and you say, this is what we think looks good on you. What do you think? And then they have the ability to give input on that. And so this unique ability to make a custom designed smile for your face is right there in our office. If we need to change anything, it takes 15 minutes. He goes
Right
and puts
there.
it in, and we have all the equipment right there. We don't send anything
So you want to
out.
make it look good. You want to
We
make it
do.
look natural.
So when we have an award-winning ceramist as part of our team, it makes it so that every single person that walks out the door gets exactly what they think that they want. You know, frankly, there's lots of opinions on how people should look. People know what they don't like. Sometimes they don't know what they do like. But as a team, the patient, myself, and with Eric right there on our team, we can put it all together so that everybody that walks out the door gets exactly what they want.
Okay.
And they get the smile that they want. They have it in their mind what they're.
So don't put it
really
off.
Feels good. They don't.
So everybody should at least go in for a consult. I mean, if you're wearing dentures, find out more.
It costs nothing to come in for a consult and talk to us. We love to do this stuff.
All right. Well, thank you for coming on the show. Very interesting.
Thank you.
Very good. We'll have to have you
bet.
back. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again or direct it to a friend, you can visit our website at wellnesshour.com. Just put in Dr. Austin's name or dental implants and you'll find him. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.